I'm 32 weeks tomorrow. I'm growing a tiny human. Apparently, they're the size of a river otter without a tail. I don't know, like this big. In the last couple days, it started to. It almost is like a whale, where it's like breaching on the surface, and you can start to see little ripples. It's wild, a little bit terrifying. First kid, in case you can't tell, but it's very exciting and definitely news in my world. So babies come on their birthdays, not when doctors think they're going to come. This little one will probably make an appearance sometime in November. We'll just have to wait and see. You know, the hospital's doing a really great job with dealing with just, sick people in general in a pandemic, but it's, in my opinion, if you're able to stay out of a hospital right now, it's great. So I'm gonna try to deliver at the birth center. That's my plan. I don't know, it's a weird time for everybody. I gotta say, it's especially weird time to be pregnant. You can imagine there's a lot to worry about all the time, and then you throw in a pandemic and a new life, and it's like, but I take one day at a time. I maybe have a leg up as a naturopathic doctor, but also it's a first pregnancy, so I worry like every other new mom. Just trying to keep myself as healthy as possible, doing my best to avoid risk of COVID exposure, because that would influence my birth plans, which are to deliver a healthy baby in a birth center. That's a good question. So right now I'm seeing patients in my office a couple days a week, and I'm also seeing patients online or over the phone via telemedicine. In my office, we always wear masks, and I try to keep myself and my patients as safe as possible. But as I get closer to my baby's birthday, I'm starting to switch over more to telemedicine. Again, because I don't want to get COVID before I deliver. I don't really want to get it at all, but I don't want to get it and have it affect my pregnancy or delivery. So switching over to more telemedicine. I've just moved into a nice newer house with really great internet, so it's made my telemedicine practice way better than it was earlier this year. When the pandemic forced us to work from home, now I get to do it of my own accord, and it's nice. It's exciting. The interactions with patients, I think, are actually enhanced because we can see each other's faces, and we're more comfortable, and we can sip water, and we can see expressions. And so the telemedicine has been a really positive thing that's come out of COVID, which is, I don't know, maybe we just need to look at the bright side for some things. Well, just a lot of self-love. Like, this is a hard time at the best of times. Throw in a pandemic, change of seasons, I don't know, wildfires and an election. Like, just be kind to yourself right now. It's a limited amount of time, and it's gonna change, and before you know it, you'll be on to the next step. So be kind, and if you are feeling sad, or if you're feeling upset, or just like something feels a little off, like, don't be afraid to seek out care. I was feeling very tired a couple weeks ago, and they're like, oh, you're pregnant, of course you're tired. And my iron was at the tank, right? We can work on my iron, and now I'm feeling a little better. Still tired because I'm growing a river otter, but feeling a little better because now my iron's getting better. So don't ignore those little feelings and thoughts that are coming up.